right, let's dive into a really intense place in medicine, the intensive care unit. High stakes, every second counts.
Absolutely. Critical care.
And we're zooming in on the role of the pharmacist there. It's vital. And it seems to be changing fast.
It really is. You know, what's striking is just how complex ICU patients have become and their medication needs. Well, they're incredibly complex too.
Right.
And for a long time, there wasn't really like a single definitive resource for critical care pharmacists navigating all that.
A gap then.
A definite gap, especially capturing the, let's say, the multifaceted nature of their job today, thinking beyond dispensing, particularly into areas like helping with diagnosis. That wasn't really covered comprehensively.
Okay, that makes sense. And that brings us to this new book, The Pharmacist's Expanded Role in Critical Care Medicine, a comprehensive guide for practitioners and trainees. Quite the title.
It is, but it captures the scope.
So for this deep dive, our mission is to kind of unpack why this guide is apparently so important now. What's the big deal? And what impact could it actually have on, patient care in the ICU?
Well, first off, this isn't just like a pamphlet. It's published by Springer Nature.
Okay, serious publisher.
Yeah, it's substantial. We're talking 55 chapters. Over 100 experts from around the world contributed.
Wow.
And its core goal, really, is to properly equip critical care pharmacists for this bigger role. Yes, optimizing meds, they're brilliant at that already.
It's also foundational.
But it pushes further. It focuses on them actively contributing to getting the diagnosis right and, directly influencing patient outcomes, improving them.
So it's directly addressing that gap you mentioned.
Exactly.
Being billed as the first truly comprehensive text for the modern critical care pharmacist, including this diagnostic piece.
Precisely. And that's where you get some really interesting aha moments in the book. It does something pretty innovative.
Oh, yeah. Like what?
It properly integrates clinical reasoning, diagnostic approaches, things like interpreting findings on a chest x-ray, maybe an ECG.
Huh. That doesn't sound like typical pharmacy school stuff.
Not traditionally, no. But this guide brings those skills into the pharmacist's toolkit. It's about preparing you, the pharmacist, for deeper involvement right there at the bedside.
That feels like a significant shift. You mentioned Chapter 1, Approach to Clinical Reasoning in Critical Care. Does it actually talk about things like diagnostic errors in the ICU?
It absolutely does, which is quite unique for this kind of text. It talks about common pitfalls, cognitive biases.
Like what kind of biases?
Well, things like anchoring bias.
Yeah.
Getting stuck on your first idea.
Right.
Or confirmation bias, where you only look for stuff that confirms what you already think. Crucially, it gives strategies for how pharmacists, with their specific expertise, can act as a check, a balance to help prevent those errors.
Interesting. So the pharmacist as a diagnostic safeguard, almost.
Kind of, yeah. A vital part of that safety net.
Are there other sort of standout contributions beyond the clinical reasoning part?
Yeah, definitely. Chapter 45 is quite forward-thinking. It's on sustainable pharmacy practice.
Sustainable. In the ICU.
Yeah, covering really practical things like minimizing medication waste, optimizing how resources are used. It's about being efficient, responsible, which has huge knock-on effects for the whole healthcare system.
That makes sense. And I saw the editors. It's a critical care pharmacist and a consultant intensivist.
Yeah, Yasir Al-Zaidi and Mohammed Abdelzahar Gebeli.
That combination seems important, that dual perspective.
It really grounds the book, doesn't it? You get the deep pharmacy knowledge and the frontline ICU medical reality combined.
Right.
And look, the impact this guide aims to boost the impact of critical care pharmacists. It's already well documented. It aligns with major guidelines from groups like ACCP, SCCM, ASHP.
And the numbers are pretty stark, aren't they?
They really are compelling. You see a significant drop in adverse drug events that's actual harm from meds.
How significant?
We're talking reductions close to 70%.
70%. Wow, that is huge for patient safety.
It's massive. And beyond safety, there's mortality. Studies show integrating an ICU pharmacist is linked with roughly a 20% reduction in the odds of dying.
20% lower odds of mortality. Okay.
Plus, their role in antimicrobial stewardship, making sure antibiotics are used right, is critical. Saves money, prevents resistance. Their value is very, very clear, quantifiable.
So pulling this all together then,
Yeah.
What's the big takeaway? What does this guide really represent for the field?
I think it means this book is set to become, frankly, indispensable, a foundational text for anyone working in or training for critical care pharmacy.
Filling that void.
Exactly, filling that void with something comprehensive, current, and really preparing pharmacists for a leadership role in that tough ICU setting. It's about enabling you, the listener, to be an even more crucial part of that team, directly impacting safety, impacting outcomes.
Which really leaves us with a final thought to chew on, doesn't it? As we wrap up this deep dive, if pharmacists are taking on this expanded role, particularly getting actively involved in diagnosis, how might that fundamentally change how healthcare teams actually work together, how they collaborate and make decisions right there at the patient's bedside?